Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Greetings and welcome to yet another transformative episode of the Healthy You program. My name is Enock Kitondekijja, your host, and I'm so honored to walk this journey of health transformation and healing with you. A special thanks goes to JCK Hospital, our esteemed partners. They make this program possible. Should you be looking for any health services, emergency response, JCK is right here at your service. You can reach them using that number on your screen. Recently, they're running a campaign, this being a month for breast cancer and breast awareness. They're running a campaign which you should check out. For all women out there, they're having great offers. You need to reach them or go to their website or Facebook and find out the details. It's ending this month. It's special for you. All right. Now, did you know that 50% of the women who are struggling with infertility today have endometriosis as the underlying factor? Now, that is according to CDC's reproductive health data. Think about this. For many years, women struggle with so much untold pain. And all they're told is, you know, it's normal, it will clear, until it affects their ability to conceive or even live normal lives. Now, could that pain you go through every month, could it be a cry by your body for help? Now, stay tuned as we unpack endometriosis and the hidden link between period pain and infertility. That's what we are discussing today. Now, to help us unpack this, critical discussion is no ordinary gentleman, but a man who has helped so many women out there, of course, working with JCK Hospital. He is an obstetric consultant. He is a gynecologist. He has combined all this to give the very best for women out there. But before I invite him to take us to the next level, I am aware of those of you who follow us on social media. Remember to subscribe. Remember to follow us. And if this conversation makes sense, you can share it with as many people as you can as we go forward to help countless lives out there. And in case you have any question, those of you who are following us on Faith Day Television, we have that number on your screen. Use it, send it in right away. Remember, the earlier you do, the better. Back to my guest, Dr. Charles. We're happy to have you once again on Faith Day Television.
Thank you, Enoch. Thank you, Enoch.
How have you been and how's your week started?
I've been okay. I took a small break over the weekend, so I've been feeling energized for the week. Yes, thank you for having me here.
We're happy to have you, Dr. Ali.
Yes.
We started a very serious discussion with you about 2 weeks ago.
Yes.
We are trying to unmask the hidden obstacles or barriers that impede women from conceiving, from reaching their journey of motherhood,
Yes.
and things like that. And you started something serious. We were talking about fibroids.
Yes.
Then you highlighted endometriosis.
Yes.
And that is something that we want to discuss today.
Yes.
Just to start off by clarity, what is endometriosis and how is it affecting women today, more so in Africa, if you would?
Thank you. Maybe I would like to welcome those who are following us. Thank you for your viewership. My name is Dr. Tung'ani Muchiri. I'm a consultant obstetrician gynecologist, that is a female reproductive health specialist. I'm happy to share with you, to learn with you about this mysterious condition that sometimes has been distressing our women. So welcome. Enoch, we were discussing about endometriosis. And I've had many descriptions from various sources, but simply put, is that this is a condition that occurs when cells that are meant to be inside the uterus leave the uterus and start growing elsewhere. To put more clarity to that, is that the uterus has special cells that line the inside. Think of the same way about your mouth. It has the walls, and inside there is a special mucosa that is constantly wet with saliva. It is the same with the uterus. It has the outer walls and then the inner lining. This inner lining is special because it's supposed to support a pregnancy. So how it acts is very different from cells in other areas of the body, in that it's supposed to thicken at certain times of the month, and then it's supposed to break down if there is no pregnancy and to shed off and bleed. Now, some of those cells, for various reasons, can migrate to other areas of the pelvic region and even to further areas of the body, and they start behaving in the same way, in that they thicken during certain times of the month, then they break down and they shed. But now the problem is that when they are located in other areas, they are not able to bleed out. So now they start causing other problems that we can discuss with time. I have a model here, probably just to illustrate is that this is the uterus, and this is the inner lining that we are talking about. Now these special cells are supposed to just shed and leave the uterus, but sometimes some of them can be found in other areas like the tubes and the ovaries and any other organ that is surrounding the uterus. Now that's when we start having problems with endometriosis. So in a nutshell, that is what endometriosis is.
So endometriosis, like you've said, it is when cells that are meant to be at a certain location, they find themselves in another different location.
Exactly.
Walk us through the journey. How does that happen?
Now, I know doctors are at risk of sounding very technical.
Yeah.
I hope I don't. But generally, there are some theories that have been put that sometimes, menstrual blood may not just leave straight out. Some of it may seep through the tubes because these are openings. And then they may be found inside. Once they come through the tubes, they get into the abdomen and the pelvis. And it's thought that that could lead to them growing where they were not supposed to be. Some people have also said that, your immune system is supposed to recognize those cells when they go there. And it's supposed to fight them because they are not in the right place. So if you had an issue with your immune system, it may not be able to fight the cells when they go where they are not supposed to be. And that leads to endometriosis. There are various other theories that say maybe it's genetic, that if your family has that history, you will most likely get it through your genes. And others that suggest that, yes, these cells look like they are from the uterus, but it's just the cells of other organs that have changed. So it's called a transformation or metaplasia in our lingo. So those are just theories. Some are stronger in science, some are not. They just help doctors try and understand. But really, to be quite honest, nobody is 100% sure. I guess only God knows, how He created the human body, so we cannot fully unravel some of these things. But lots of research is going on, and that has led to discovery of even some risk factors.
Yes. Yeah, and I think that is something that our viewers would want to understand, the risk factors that could predispose you to having these cells in a wrong place.
Okay.
Yeah.
Now, risk factors are, just to briefly explain, are things that put you at higher risk than the average person to getting a condition.
Yeah.
They're not necessarily things that lead direct link to the disease.
Yeah.
So they put you at a higher risk. So some of them we've discovered. And to put a background to that is to say that this condition responds to hormones, the hormones of reproduction, mainly estrogen. So with higher estrogen, the severity may be more. And indeed, that is why symptoms are more severe in women of reproductive age as compared to older women. So now, because it's a condition associated with menstruation, it goes without saying that the more cycles you have, the higher the risk. So it has been found that when you start your cycle quite early in life, or it ends quite late, that is late menopause and early menarche, you are likely to be at a higher risk. Likewise, if your cycle is very short, that is, you have many cycles in a year, the risk is slightly higher. We've also found that when childbearing is delayed, all these things, if you look at them, they're just showing more cycles. The more cycles you have, the higher the risk. There are other less common risk factors. For example, low BMI, that is women with low body mass index, that is very lean, maybe very small. Those are lesser risk factors, but nonetheless noticed. And of course, if there is family history of endometriosis in your family, there is a high likelihood. You'll find, like a daughter brought by the mom, and the mom is saying that I also had the same problem at this age. So there is that element of family history. Those are some of the known risk factors. Of course, there are many others, but those are the ones that have been truly captured by data.
Okay.
Yes.
Right. Thank you so much for that background. Those of you who are just tuning in, the expert is breaking down very important information that if you find yourself struggling with endometriosis, You know, there are so many factors that could have predisposed you to this. It could be a family predisposition, you know, it could be hormonal imbalances like he has talked about. And as long as you're a woman, there are higher chances that you might go through this, what they call endometriosis. But before we even advance, we would want to understand, doctor, from you, how does it now present? We now know that, okay, internally, we get this uterus, the endometrium or the lining of the uterus in other places.
Yes.
So how does it present? What are the red flags? What should someone look out for to know that, okay, something unusual is happening?
Okay.
Yeah.
Now, before we even go there, it is good to note that the extent of disease may not reflect the extent of symptoms. In that there are some people with very extensive, you know, infiltration by those cells,
Yeah.
but they have very minimal symptoms. There are other people with very little infiltrations, let me call them infiltrations, the cells that have gone to other places, but their symptoms are up there. And what are these symptoms anyway? Some people have no symptoms, in that the disease will be there, but they will not be able to recognize because probably of where it has affected. But depending on where it has affected, some of the common symptoms include pain. It can be constant pain, what we call chronic pelvic pain, or it can be pain during menses, what we call dysmenorrhea. It can be pain during movement, or it can be pain during intercourse, or it can be pain when going for a long call. Now, when we start talking about that is when it has started getting close to the gut. Remember, the gut is usually just behind the uterus. So any disease affecting that area may get to the gut and it may cause pain. It may also affect the bladder because the bladder is in front of the uterus, in which case it can cause symptoms, urinary symptoms, that is maybe pain during urination, or sometimes in rare occasions the urine may have some blood because remember the tissues bleed.
Yeah.
So the symptoms from there on will depend on where the disease is. Remember, these are cells that can migrate.
Yeah.
They can go to the gut. They can even go up to the lungs and other areas. So I would say the most common presentation is no symptoms, pain, or abnormal bleeding. This bleeding depends on where the small lesions are. If they're in the bladder, it can come through urine. If they're in the gut, it can come through the long haul. Other symptoms now depend on the exact location. Of course, we cannot ignore the issue of fertility because indeed that is like one of the common also presenting symptoms or complaints from patients.
Okay. What do you mean by fertility? Because now you are getting to address the elephant in the room. I know most of our viewers are waiting for that.
Yes.
Because you see now the challenge you have, Daktari,
Yes.
that for all people,
Yes.
and this is science,
Yes.
for all the people who are struggling with infertility,
Yes.
you know, half of the population of the women struggling,
Yes.
they are always coming up with the diagnosis endometriosis.
Yes.
How serious is that?
Mm.
And how do you get to that diagnosis?
Mm-hmm.
Actually, before actually going to infertility,
Yes.
help us now narrow down to how do we get to that actual diagnosis? This is endometriosis.
Mm-hmm.
This is not just pain because most people think
Yes.
whichever pain you have now, it is endometriosis because of the numbers.
Yes.
So help us now come to that actual understanding. When do you come to the diagnosis? This is endometriosis.
Mm-hmm.
Then from there,
Yes.
we can notch into now how does it affect fertility or the ability to conceive?
Okay.
Yeah.
So with medicine, there is a procedural way of coming up with a diagnosis. You first listen to the patient, you examine, and then you do the necessary investigations or tests to find out. So from just history, that is what the patient tells you, you can be able to narrow down this kind of pain, or she's not been able to conceive. Why is it? Or she's been bleeding. It helps you to narrow down, where am I going to examine? And in examining, you are trying to look for two things. The presence of pain and the presence of changes in the anatomy. Because some of the things the endometriosis will do is that it will fix these organs, that they're supposed to be mobile, they stop being mobile. So when we are doing physical examination, we are very keen to note these things. From there now, you are able to do the necessary tests. One of the commonest tests we do is imaging. We can do an ultrasound, and thankfully these days our experts are getting more and more knowledgeable about diagnosing endometriosis. In the past, the ultrasounds were not very clear and the expertise was not quite there. Now we are getting there. We're able to make a diagnosis from just an ultrasound, or what we call an MRI, magnetic resonance imaging. Beyond there, if you're still not able to come up with a diagnosis, we can recommend what we call minimally invasive surgery, where we just use a scope to look at the pelvic organs. We may even take a small sample from where we think there is a problem and subject it to laboratory microscopic examination to look for those cells. From there, we are able to make a definitive diagnosis of endometriosis, because not all pelvic pain is endometriosis. Whereas more than 4 out of 10 women, that is more than 40%, sometimes even 50% of women with chronic pelvic pain will end up being diagnosed with endometriosis, and even up to, let's say, more than 30 or 40% of women with infertility, secondary infertility, may end up having endometriosis. Not all that should be blamed on it. There is what we call differential diagnosis in medicine. That is, if it's not malaria, can it be typhoid? If it's not this, can it be this? So we have those differential diagnoses. Maybe I can mention just a few so that people are in the know. Common one that can cause that kind of pain is infections. Infections of the pelvic organs, what we call PID, pelvic inflammatory disease. We also have growths that can cause that kind of pain. We have what we call ovarian cysts that can occur on the ovaries. We have what we call fibroids that are growths on the uterus, and this can cause the same kind of pain and even sometimes bleeding. And we can have conditions that affect either the bladder or the gut. For example, urinary tract infections, they can also cause pelvic pain. We can have conditions that cause inflammation of the bowel. Those are called differential diagnosis. So that when you are listening to the patient, when you're examining, and when you're doing the imaging, you are trying to kick them out so that you remain with your diagnosis. So it's good that you say that not all pelvic pain is endometriosis, but a lot of it can be attributed to it.
To endometriosis.
Yes.
Wow, that is quality. Those of you who are just tuning in, this is Faith Today Television, and we are bringing you expert insights into what so many people are struggling with. Call it endometriosis. So many people go through pain while they're going through their monthly periods for the women, and more often than not, they get to have challenges with the fertility and conception. And that is what the doctor here is dissecting, cutting through the fluff and giving us the actual information we need to know. Dr. Ali, I know we are going to take a short break, but
Yes.
before we do, how does this endometriosis now affect fertility, the ability to conceive?
Okay.
Yes.
If just to remind people about the biology, is that for there to be a conception, there has to be a healthy male gamete that has to be able to travel all the way through the tubes to meet the egg. And then the egg has to be also healthy and meet the gamete, and they make their way back to the uterus. Now, think of the tube as a very thin straw that is very fragile. If there are any small changes, its anatomy is likely to change. And think of the gametes as very tiny specks that have to pass here. So the whole process has to be very meticulous. And it's actually amazing how we were created. Now, if there is disease in the tube, it will obviously interfere with that process. So we know that with endometriosis, when the cells leave, they go to other areas, they start behaving like they were in the uterus. That is, they thicken, they break down, then they shed, causing bleeding. They cause bleeding in areas that is not supposed to have bleeding. They also cause irritation or inflammation in those areas. So what happens? Most tissues will form scar tissue. Now that scarring can change the whole anatomy of the area. So in endometriosis, you'll find very thick scars holding the tube. A tube that is supposed to be very soft and mobile is held still. Sometimes it even closes. So what does that mean? It means that the eggs cannot pass. So there is blockage, and pregnancy cannot happen. Another thing that has been found to happen is that endometriosis can affect the ovaries. If it affects the ovaries, they also have bleeding inside, what we call cysts, or you'll hear them being called chocolate cysts. There is nothing sweet about them, even though they are called chocolate cysts. It's just because of the color of the blood that is inside is chocolate in color.
Okay.
So now this affect the formation of the egg. So those are two ways that endometriosis can affect fertility. And indeed, it's quite common, but there are ways that this can be remedied.
Yeah. And I think that's very important to understand the physiology, what really happens in there, and how the ability to conceive is being impeded. Daktari, you talk about sensitive matters here, and I think, I'm sure we're going to take a short break, but there's so many myths around this, but there are also very many fears, because when you talk about endometriosis, in the country, we've had stories of people who even have lost their lives. We've had it, and then it's something that we need to understand. Can it be remedied? Can it be handled? Is there any approach to it? Or once you have endometriosis, that is equivalent to infertility and the probably losing life, things like that. So we would want to understand, is there anything that can be done? For our viewers, that is a conversation you don't want to miss. You want to go to the solutions, the prevention. How can you live with endometriosis? And do people who have endometriosis conceive? That is a discussion you don't want to miss, and we want to handle it in a more surgical way when we return. That's why you don't have to change your diet. And again, if you have any question, the expert is here to meticulously handle that and give you the right answer, so that we allay all the anxiety and the fears that you could be having in regards to fertility, and in this case, endometriosis. Coming back in a short while, don't go anywhere.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, Our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enoch. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
All right, welcome back once again to our discussion. We are talking about endometriosis being uncovered, and we are having an expert helping us understand the relationship between period pain that most women go through and infertility. Not only that, today we are getting quality information and so much more, how this even affects your overall health. There's so much that we have been able to unlock about how endometriosis comes out and how it presents in our bodies, and so much quality information. This second part of our discussion, we want to understand, does it even have a cure? What is the approach? Are there any treatment options? From our expert right here. And I want to acknowledge those who've sent in questions. Thank you so much. I've seen a question from Fidelis. Thank you, Fidelis, for watching, from Risambu. Risambu, actually, that is a very good place. That's where JCK Hospital is. In case you need more thorough information, you can reach JCK Hospital just next to Happy Life Children's Home, just along Lumumba Drive. I've seen a question from Emma. Thank you, Emma, for tuning in. I hope you have invited your friends and colleagues to tune in as well. Esther, thank you so much. I've seen a question from Lilian Gidurai. I have a question from Anne Tome. So many of you are sure we're going to be answering them. So, Doctor, before we took a break, we were talking about the approach to treatment.
Yes.
You know, because when you hear about endometriosis, so many people may get the phobia that, you know, that is a gone case. If it is endometriosis, I'll never conceive. We've seen people lose their lives. Are there treatment options for this?
Definitely.
Okay.
Yes. And there are various. Because we understand three main things about endometriosis, we've been able to work a treatment or management plan. We understand that, one, these are physical deposits that can actually be seen. You know, these are cells, they congregate somewhere, you can see them. Number two, we understand that they respond to the hormones of reproduction. And number three, we understand that they cause various symptoms. So with those three basic principles, we're able to formulate a plan of treatment. whether we want to deal with the symptoms, whether we want to deal with the physical deposits, whether we want to deal with the hormones that influence them. So that forms 3 levels of treatment. And the first level is you can deal with the symptoms. I mean, somebody has pain and disease is moderate or mild. You can deal with the pain. Probably they're still able to bear children. They still have a normal cycle. All the other organs have not been affected. You can deal with the symptoms of pain. Or if they are not able to conceive, you can find ways of helping them conceive, which we can look at much more detail later. You can go to the next level and decide, okay, this condition responds to hormones of reproduction. So if we follow that avenue, we may be able to control its extent and its symptoms. So we can decide to shut off the hormones, or we can decide to counter them. One of the hormones we commonly counter is called estrogen. So we can give you another one we call progesterone, which can counter that. Or we can decide, okay, let us completely first put them off as we try and control the extent of disease. So there are some medications you can give that temporarily just shut off the reproductive hormones. Sort of a temporary menopause. We may decide to give you something slight to relieve the symptoms of menopause. But basically we are giving you hormones to counter the hormonal effect, the body's own hormones. So that is the next level, which is hormonal treatment. If you are not getting headway with that, or our goals of treatment are not in line with that, then we have the surgical option. Because we said these are deposits that can be seen, and they are causing changes that you can see. For example, you may have deposits here and what we call adhesions, which is scar tissue, thick fibrous tissue that is holding the organs together. You can decide to go relieve that. You can decide to go remove the deposits that you can see of those cells, because sometimes they will appear as inflamed or irritated areas with some bleeding. You may be able to remove part or even all of it and relieve the symptoms. That is usually the extent that most people will go. However, there are some extreme cases that may require what we call radical treatments. These are treatments where you say, fine, even the ovaries have to go, probably even the uterus if it's affected. That is rarely necessary in modern times, because we have all a wide array of treatments to do before we get there. But it's an option. Where the deposits are in other areas, maybe in the gut, higher, maybe on even sometimes the diaphragm, sometimes in the lung. It may sometimes
in the lungs.
Yes.
Are you sure?
Yes.
That is serious now.
In fact, one of the awareness, that brought endometriosis into the picture was when one of our presenters had it in her lungs, and it was really a distressing story for her. So they can still go there, and now we start involving other specialists. If it's the lungs, you need to have a cardiothoracic surgeon there. If it's on the diaphragm, you may need a surgeon. If it's in the gut, so that you decide is it somewhere where it can be removed whole and relieve these symptoms, or what do we need to do? So the treatment goals is in those 3 levels. Are you treating the symptoms? Are you dealing with the hormones? Or are you surgically removing the physical lesions?
Wow.
Yes.
I like the approach that medics have to this, because at first it was worrying, scaring, but now we understand that, okay, there is hope. There's something that can be done. And symptomatically, we talked about hormones, we've now talked about surgery. So there are options.
There are options.
Okay.
Yes.
Okay.
There is absolutely hope.
There is hope. Faith Today Television it is. We have a first question coming in from Fidelis Risambu. Does having a family history of endometriosis increase your chances of getting it?
Yes, I had talked about a genetic theory that has been advanced, that there are some genes that may advance or may increase your risk of endometriosis. And anecdotally, that is from just my own observation in practice, you'll have somebody tell you, even my mom or my sister tells me that they had very severe period pain. So there is that component, yes.
There's that component. All right. Emma says, hi, Emma here. Can endometriosis develop later in life, or does it usually start when someone is younger?
Endometriosis can occur at any point in your reproductive life.
Okay.
Of course, the highest risk is during your early years of reproductive life and from your 20s. The risk lowers quite significantly as you approach the ages of menopause. And of course, during the years of pregnancy, when childbearing, the risk is slightly reduced because the symptoms will slightly wane during pregnancy. Okay. So diagnosis may not be made, but it can occur at any point during your reproductive health.
Oh, all right. We have Esther here saying, why do some women with endometriosis feel pain even after their periods are over?
Yes, that is the pain of endometriosis is what I would call multifactorial. Okay, there is of course the irritation caused by the cells themselves, but also remember it is causing changes in other organs. One of the things that it does is that it causes scarring in the pelvic region. So those scars form very tight, what we call adhesions, and that can also cause pain. And that pain can now be constant, as opposed to the one that just comes during the menses when the hormones go high.
Wow, this is quality information. I hope you are getting as much value as you can this morning. Again, Faith Today Television is here to transform Africa, transforming lives and the like. So if you would want to support this movement, it is very affordable, very easy. We have made it possible for everyone at whatever level to support and stand with this movement. We have those numbers on your screen, those tiers on your screen. You can support this movement so that we can create awareness and help so many people who didn't know that actually help exists. Thank you so much as you do that. All right. Quite a number of questions are coming in. Thank you so much. We have Helen. Helen is saying, does removing endometriosis surgically help with fertility in the long term?
The answer is yes to some extent, because it depends on the extent of damage or changes that have been made to your organs, mainly the tubes and the ovaries. So if it's the tubes and probably the damage was not so much, surgical intervention may help. If it's the ovaries, you may need more treatment to enhance fertility. But for some cases, you may need to have other interventions, because we may only be doing the surgery to relieve your symptoms of pain, but we may not be able to salvage the tubes, in which case now we have to explore other options of solving your fertility issue.
Wow. I'm enjoying this myself. Another one, though they didn't specify the name, they just forwarded, is birth control really helpful in managing endometriosis? Birth control.
Yes. In fact, one of the first line therapies when you're talking about the hormonal aspect is the normal birth control pills, because what they will do is that they will suppress your body's levels of the hormones. And in that way, they can counter the hormonal aspect and help control the symptoms. One of the other birth control methods has what we call progesterone, which can counter the estrogen we are talking about. So yes, the hormonal birth control pills and even to the large extent the injections can help with symptoms of endometriosis.
Well, you talked about hormonal management.
Yes.
That is one of the approaches you have
Yes.
in dealing with endometriosis.
Yes.
I love it that there is something that you guys are doing. Is there any advancement in technology that has made it easier for you to pick up these diseases a bit earlier currently?
Yes, there are various aspects. One is that there is awareness. I like that women these days are reading, they are coming to you with information.
Okay.
And that awareness alone has made them seek help earlier. And has made also us, the healthcare providers, to be on our toes and keep researching more. Secondly is that there has been advancement in imaging. Our ultrasounds these days are very clear. And number two, the experts are also learning more and more on how to pick these conditions. MRIs are more readily available in the country lately. Number three is that there has been quite advancement in minimally invasive surgery. That is what we call laparoscopy in the country. I know the other countries have gone robotic and all that, but laparoscopy has been picking up, and most of these conditions are now picked easily and well managed. There is still research going on are there tests we can do, maybe blood test or saliva, that we can just pick and we are able to pick that this marker is there and it means endometriosis is present, without even just going to do surgery and all that. So research is advancing quite fast.
Okay.
Yes.
Wow, that is very profound. There's another one from Anne in Thome. Anne in Thome says, I love the conversation today. How can we raise more awareness so that girls and women don't normalize severe pain?
Thank you, Anne. And that is, in fact, a very good suggestion stroke question, that we need to have more awareness. One of the myths that has existed for the longest time is that even when you have severe period pain that stops you from doing your daily activity, you are told, it's just period pain, deal with it, and that needs to be debunked. So one of the ways that people are doing is having such shows. Also, we've had many gynecologists doing school talks, talking to girls when they're just having their first year of menses, talking in churches. I know there are various groups that are doing fantastic jobs in raising awareness and support. I'm sure you've seen a yellow ribbon somewhere. Yeah, that is awareness for endometriosis. There's even an endometriosis awareness day, awareness month. I've seen groups on social media like Endo Sisters, and that are support groups basically for people affected by the condition. So much is going on in the background, but we can still do more, especially through social media, because that is where you'll reach most women of the age group that is affected. So Enock, you're also doing a good job, doing this show.
I needed to hear that as well. Of course, powered by Faith Today television. And again, actually, I think we can do so much on social media. Also, if we work together as a team, the viewers and decision makers out there, when you see such conversations, I think it is not harmful when someone pressed the forward, the share button, so that as many people get to know this information.
Exactly.
Because, growing up, I mean, in the African tradition, most people think that if you are a woman, that pain is part of you. You have to,
Yes, which is wrong.
And you have debunked it today. It's wrong. Yeah, so for our viewers, awareness is very key, and the good thing, these questions are coming from you. It's important we share this information, we create more awareness, we share hope, and JCK Hospital is at the forefront of this. Remember, their focus is health for the body, mind, and soul. So they are having a holistic approach to that, and we want to commend them for their great work. Dr. This is a very interesting discussion, and I know my viewer out there might strangle me if I do not ask this question.
Yes.
So then, understanding the impact of endometriosis and how it can affect not just the pelvic, but you've talked about other places, the lungs, and even affecting life. So what should someone do right now to prevent this, this occurrence?
Okay.
Yes.
First is a message of hope to anybody living with endometriosis, because you've heard there are so many options for treatment, and even if I was to quote Psalms, I think it's 34:18 that says, "God is close to the brokenhearted." So the first thing is hope. That not is lost. Even if you come and we give you that diagnosis, you are still in good hands. Secondly is to live positively and healthy, because most people despair. They stop watching their health, they stop exercising, they stop eating healthy, and they start indulging in other things that may harm their overall health, including their psychological health. So live positively and live healthy. The third thing is to seek treatment early. You go see your healthcare worker, see a qualified healthcare worker, have a treatment plan. Follow I know the diagnostic journey is quite tough for most people, because you are unsure, you don't want the results to come out bad, and it takes some time because you are sent for this test, you're sent to go do that, but just have the strength to follow the diagnosis through. Once the diagnosis is followed through, have a treatment plan and stick to it. If it's working for you, stick to it. If you don't feel you're getting better, discuss with your healthcare provider so that you have a continuous running plan for your treatment. If you have now some of the complications that we expect, now we'll deal with them one by one. And when I say complications, I'm talking about three main things. I'm talking about fertility issues. I'm talking about chronic pelvic pain, that is, the pain will not go away. I'm talking about changes to the organs affected, whether it's the gut, the bladder, the uterus, if the lungs and all that. So now we need to identify, your healthcare worker needs to be able to identify those complications and give you a plan on how to deal with them. If it's a plan that involves more invasive procedures, well and good. Look for the facility that you can be able to get that help. But it is important to live positive, to have hope, and to stay healthy.
Staying healthy is very important.
Yes.
Thank you so much. And you can have your parting shots and probably share your contact.
Yes.
So that someone can reach you when they need to get more information.
Okay. Yeah. So first is to say thank you for your viewership. We don't take it for granted, and your engagement. Very good questions coming in. If you suspect you may have the condition, seek help. There are many places. There are so many gynecologists these days in almost every town where you can get the help. If you have been diagnosed with a condition, take heart. It's not a debilitating condition, and forget those myths that exist that it occurred because you did this or that. Those are neither here nor there. Just stay positive. stay mentally active, stay physically active, live healthy lifestyle, and follow up on your treatment. There is hope for everyone. If you need to see a specialist, you can always contact. My name is Dr. Tung'ani Muchiri. My contact is 0780 477 862. That is 0780 477 862. And like Enock said, JCK Hospital in Roysambu is also open 24/7 for anybody who wants to visit.
All right. Thank you so much. And we appreciate the work you guys are doing at JCK Hospital. And we can tell that if someone comes, they're really going to get value. We appreciate your expertise, Doctor. Thank you so much. And then back to our viewers, we also want to appreciate you. Thank you for tuning in to Faith Today Television. We now know that endometriosis happens out there. When you have the diagnosis made, there are treatment options available for you. It is not a death sentence. It is not. It's not something you should worry about. There is a remedy for everything. Again, prevention is always better and cheaper than cure. He has talked about lifestyle changes. Make sure you pay attention to whatever you eat. Some of the things that disrupt our hormones are from what we eat and what we are exposed to. So it's important to exercise, remove all the toxins from your body. It will help you a lot. Get enough rest, pay attention to your body. And remember, God also wants you to be healthy in all aspects of life, as the scriptures say. Again, these doctors are not here, but as an extension of God's healing hand towards us. God heals, and God is interested in your overall well-being. Thank you so much for keeping it Faith Today Television. My name is Enock Kitondekijja, and you have been watching the Healthy You program. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.